Okay, so here behind this, we have the right atrium. So this is the right atrium. Okay, leading into the right atrium, we have this right here, which is the superior vena cava, number 16, superior vena cava. Also leading into the right atrium is the inferior vena cava, that's below. And also leading into the right atrium is something known as the coronary sinus, which is in the back right here. Coronary sinus, number 27, coronary sinus. Okay, coronary sinus, superior vena cava, inferior vena cava, leading to the right atrium. Okay, so that's the right atrium. Then we have the right ventricle behind here. So this whole thing is the right ventricle. Okay, and between the right atrium and the right ventricle, we have this guy right here, number 35. That's the tricuspid valve, also known as the left AV valve. Right? These little guys that look like little spider webs, those are your chordae tendineae. And then the red guys here, here, and here, these red guys right here are representing the papillary muscles. So don't pay attention to the numbers and on the key, just know that these guys are your papillary muscles. And then these muscular ridges here, these muscular ridges here are your trabecular carnae. Trabecular carnae, papillary muscles. And then in the right atrium, these ridges, these muscular ridges are pectinate muscles. Okay, so from the right ventricle, this valve right here, so you can see it here and a little bit here, number 37, is your pulmonary semilunar valve. Okay, and then leading further is the number 9 is the pulmonary trunk, which then branches into the left and the right pulmonary artery. So this is the left and right pulmonary arteries. On this side, you can see the right pulmonary artery also here. So that's the right pulmonary artery going to the right lung. Okay. All right, then on this side, we've got the left atrium. So behind here is the left atrium, And here is your left ventricle. So left ventricle. Okay, and then this valve is called the bicuspid valve. Number 41 is the bicuspid valve, also known as the mitral valve, also known as the left atrioventricular valve. These are, again, the chordae tendineae, these little spiderwebby looking things. And then number 62, number 42, and like this guy right here represents the papillary muscles, okay? And then these ridges right here are your trabecular carnae, okay? And then deep in the left ventricle right here, so number 45 behind there, that it represents the aortic semilunar valve that leads to the aorta, which is right here. So this right here is the aorta. That's actually the ascending aorta portion. This is number 12 is the aortic arch, and then you can, a little bit behind here, you can actually see the thoracic aorta. Okay, so that's the portion, that's the descending aorta, and this portion particularly going in the thoracic cavity is the thoracic aorta. Here, now that we have the posterior portion of the left atrium, here, these two guys, and also here, these guys, so number 8, and now also number 8 on this, that's your pulmonary veins. So your pulmonary veins, these guys, these are the left pulmonary veins, right pulmonary veins. They both are coming from your lungs, from your right lungs, your left lungs, bringing oxygen-rich blood back to the left atrium. Okay. Now, these blood vessels off of the aortic arch, the first one, number 13, is your brachiocephalic trunk, also known as the brachiocephalic artery. This one is left common carotid artery and left subclavian artery. And then here, these blood vessels that lead to the superior vena cava are your right brachiocephalic vein, much shorter than the left brachiocephalic vein. So left brachiocephalic vein, right brachiocephalic vein, leading to the superior vena cava. There's one more blood vessel that leads to the superior vena cava from behind. This, number 59, is your azygos vein. Okay, and then let's see, there's a couple of other structures. So here, this would be like the apex of the heart. Behind right here is the base. Here, between the intraatrial septum, like around this region, right around here, that's what that's supposed to represent, is the fossa ovalis. That little depression is supposed to be the fossa ovalis, which is a remnant of something in the fetal heart known as the fetal foramen ovale. And then here, this little structure right here, this little ligamentous structure, that's called the ligamentum arteriosum. Ligamentum arteriosum, which is a remnant of a fetal structure known as ductus arteriosus. But on here, it's known as ligamentum arteriosum. And then there's some coronary arteries that you have to know, and cardiac veins. So the first two branches off of the aorta, there's this guy right here, number 31. That's your right coronary artery that goes down, 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 down here, further, further down. All right. And one of these branches you have to know is number 63 right here, right on the margin of the heart, called the marginal artery, marginal coronary artery. And then its other branch coming off of the right coronary artery is, if I take this off and look at it from the back over here, in the back right here would be your posterior interventricular artery. Posterior interventricular artery, also known as posterior descending artery, that sits in the posterior interventricular sulcus. So there's like a little groove here called the posterior interventricular sulcus. So your posterior interventricular artery sits in that, right? And then also branching off of the aorta is the left coronary artery. So you can't see where it's branching, it's behind the pulmonary trunk, but you can see a little bit of it here. So right here is the left coronary artery, and that splits pretty quickly and creates the anterior interventricular artery. So that's number 50. And also something known as the circumflex artery. So that would goes around, 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 around to here and meets together with the posterior interventricular artery. Okay, so your anterior interventricular artery sits in a sulcus, in a little groove called the anterior interventricular sulcus. Right? And this groove right here that kind of separates the atria from the ventricles, kind of like a crown on the head, is this whole groove right here is your coronary sulcus. Okay. All right, let's talk about the cardiac veins. So the cardiac veins bring oxygen, poor blood from the heart wall. So this guy right here is called the great cardiac vein. Great cardiac vein. These guys right here are the anterior cardiac veins. Okay, there's actually on the other heart model, there's like two. And then this guy right here is called the small cardiac vein. Small cardiac vein, anterior cardiac vein, great cardiac vein. And then the back here, number 60, sitting in the same sulcus as the posterior interventricular artery, is the middle cardiac vein. So middle cardiac vein, posterior interventricular artery, both sit in the posterior interventricular sulcus, whereas the great cardiac vein and the anterior interventricular artery sit in the anterior interventricular sulcus. And that is pretty much all the structures you have to know. There's also the interventricular septum. So here's the interatrial septum. That's just the wall between the right and the left atria. The interventricular septum is just this wall right here between the right and left ventricles. And that is it.